Tensions explode on Capitol Hill as Suzan DelBene directly challenges Robert F. Kennedy Jr. over a policy that critics say is delaying care for vulnerable patients.
Ms. DelBene.
Thank you, Mr. Chairman. Mr. Secretary, I'm glad you're appearing before us today. Under your leadership, CMS recently added new layers of red tape that Medicare patients need to navigate to get the care that they're entitled to. Mr. Secretary, I hope you understand the harm that delaying and denying necessary care can have. Do you remember saying this, quote, "Americans shouldn't have to negotiate with their insurer to get the care they need. Pitting patients and their doctors against massive companies was not good for anyone," end quote. Do you remember?
I don't remember, but I would align with that.
And I'll submit for the record actually a press release from CMS with your quote in that from June 23rd of 2025.
Without objection.
In this case, I agree. Pitting patients and their doctors against massive companies isn't good for anyone. And yet, less than a week after you said that, CMS announced the Wiser model. The program allows private companies to use AI to review traditional Medicare claims and pays them based on the amount of care they deny. This program went into place in 6 states across the country, including my home state of Washington. President Trump said multiple times on the campaign trail that he would not cut Medicare, but this program does exactly that. For example, Joanne is a senior from Washington on Medicare. She has a herniated disc that is pinching her sciatic nerve, causing immense pain down the right side of her body. Her doctor prescribed an injection that would help relieve her pain. If it had been prescribed last year, she would have received the treatment, no problem. But because of the Wiser model that has been implemented, she's been in intense pain for over 6 weeks while she waits for approval. She has been using crutches or a wheelchair for over a month now, which is making her arthritis worse, adding to her chronic pain. Since using crutches, she's fallen multiple times, including earlier this week. Instead of simply approving the procedure, Joanne's conditions are getting worse. And Secretary Kennedy, the W in the Wiser model stands for wasteful. Do you think that Joanne's treatment, which would allow her to walk and live with less pain that her doctor has prescribed, do you think that's wasteful?
Do you want me to actually answer that question?
Yeah.
I think that that's a terrible outcome. It's one that was not intended by the system, obviously. The problem is there's tremendous ways. In Medicaid, there's only 5% of the cases are given prior authorization. In private industry, 30%.
This is traditional Medicare now, where it's now, this has only been put under prior authorization under your leadership. Now, President Trump promised multiple times that he, quote, will not lay a finger on Medicare. Given President Trump's promise, did you or the president approve this model, which is now delaying and denying care for people in states like the state of Washington?
Can I answer the question?
Yeah,
so
people are being denied care across our state right now.
Very quickly. And this is an example. 5 years ago, we were paying $250,000 a year for $250 million for skin substitutes. This year, $23 billion. Why? Because there was no prior authorization in the Medicare program.
And now someone like Joanne is not getting her care. It's more expensive for us because Joanne is not getting her care. We have story after story. I can also submit for the record stories of all the people who are being delayed and denied care. It is more expensive for us. It is more expensive for them when they are not getting the care they need. Last year, I sent CMS a letter detailing my concerns about the Wiser model. I still have not gotten a response. That was last August. Can you publicly commit to responding to that letter and addressing the concerns of this harmful model?
Yeah, absolutely, we will. And I apologize for not getting back to you sooner. We have an unprecedented number of communications from Congress.
Well, we don't have you here very often. We have people in my state who are being denied care, who are being hurt based on this policy, and there's an indifference to the challenges that they are facing, all because of a model put in place for no reason and doing exactly what you said shouldn't happen, which is, and I quote, pitting patients and their doctors against massive companies. These are private companies doing this prior authorization. It was not good for anyone. Thank you. I yield back, Mr. Chairman.
Discovering $23 billion worth of fraud is not for no reason. And that
you are hurting patients in our state and other states across the country for no reason. Right. And I appreciate you finally responding to the letter. Thank you. I yield back.
This exchange between Suzan DelBene and Robert F. Kennedy Jr. cuts right to the heart of a problem that doesn't have an easy answer. How do you reduce waste in a massive system like Medicare without hurting the very people it's meant to protect? DelBene's argument is built around something powerful, real human impact. She doesn't stay in abstract policy language. She brings up a specific case, a patient waiting in pain, getting worse while bureaucracy slows things down. That's a strategy that resonates because it translates policy into consequence. When people hear about delays, they don't think cost control, they think suffering. On the other side, Kennedy isn't dismissing that suffering. He acknowledges it as a terrible outcome, which matters. But he pivots quickly to the bigger picture: systemic abuse, ballooning costs, and the need for oversight. The example he gives, spending jumping from hundreds of millions to tens of billions, signals what policymakers fear most: a system being exploited at scale. And this is where the tension becomes unavoidable. Because both arguments can be true at the same time. There can be massive waste in the system and real patients getting caught in the crossfire of reforms meant to fix it. That's the uncomfortable reality this exchange exposes. Fixing one problem can create another. The most revealing moment is that brief line, "Do you want me to actually answer that question?" It's not just a pause, it's a signal. It shows how loaded the question is. If he says yes, it's wasteful, it sounds cold. If he says no, it undermines the policy itself. That hesitation reflects the political tightrope leaders walk when policy meets human consequence. What also stands out is the deeper structural issue being raised: who should make these decisions? The criticism of private companies using AI to approve or deny care taps into a growing concern about automation in healthcare. Efficiency increases, but accountability can feel more distant, especially to patients who don't understand why they're being denied. At the same time, Kennedy's defense highlights a key fear inside government: if you don't introduce controls like prior authorization, spending can spiral quickly, and that threatens the sustainability of the entire system. In other words, unchecked access today could mean reduced access tomorrow. So what you're really watching here isn't just a heated exchange, it's a collision between two priorities that rarely align perfectly: speed of care versus control of cost. And the truth is, there's no simple fix. Move too fast to cut waste, and people suffer delays. Move too slowly, and the system becomes unsustainable. That balance is where policy either succeeds quietly, or fails loudly, like moments like this.